And it is the voice of Indiana County, WCCS 101.1 FM, AM 1160, and WCCSradio.com. Today is World Mental Health Day, and on the line with us is Dr. Joseph Buzogany. He is a IRMC physician, psychiatrist with the IRMC Physician Group, and he is an adult and forensic psychiatrist, and we visit with him on World Mental Health Day. Our conversation is brought to you by Marcus & Mack, voted Best Personal Injury Law Firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Dr. Buzogany, good morning.
Good morning.
It's good to have you with us here today. World Mental Health Day. I don't think probably 20 or 30 years ago people would have even considered such a day today, such a designation. But World Mental Health is certainly something that we need to pay attention to, and not just on a world level, but certainly on a personal level. And lots of folks are today, I think, finding resources that maybe in the past weren't available to them. And maybe the whole idea of mental health, people are taking a new look at it, aren't they?
Well, first, thank you for having me on. It's a pleasure to be with you this morning. Absolutely. Mental health has come to the forefront in many areas, to include everyone's personal day lives, their family, and, as you know, politics as well. Mental Health Day, I believe, is an opportunity to remind people that mental health and mental illness is a significant part of our lives, but it's treatable. As you mentioned, the resources that are available for mental health in the community, they are going to expand tremendously in the next 14 to 16 months. As some people know, we are building an inpatient psychiatric hospital dedicated strictly to psychiatric patients. It will be on the IRMC campus. 32,000 square feet. It will have 44 beds. It will have 8 adolescent beds, 24 adult beds, and 12 geropsych beds. This will be a game changer for the community.
Yeah, it absolutely will.
Yeah.
And one of the things about it, we can actually see it when we come onto campus. We can see the progress as that is being built. Is the idea that IRMC is making a commitment to something that has been a real problem that hasn't been addressed as properly as it should have been down through the years, and to see IRMC stepping in and doing something like this, the community just has to be thrilled by it.
Absolutely. We here at IRMC have been committed to mental health. While many facilities have closed their mental health and psychiatric units because they're not typically profitable, we've made a commitment to keep our psychiatric and mental health program operating. This came about as a carve-out of some reinvestment dollars that were obtained from Southwest Behavioral, and we were allocated a portion of this, which our CEO, Steve Wolf, decided would be great to put toward a mental health facility that our county has required for many years. One of the biggest problems that we have is a phenomenon called ER boarding. This is where mental health patients are brought to the emergency department from various sources and are required to sit in the emergency room for, at times, weeks, waiting for inpatient care. Inpatient psychiatric care has become very difficult as a result of numerous issues, one of which obviously was COVID. But the other one is just the lack of resources for the amount of mentally ill people that we see.
What are some of the effects that we'll see from it? There obviously will be a great effect on what's happening at the ER, but that's a residual effect because it will free up the ER to do what it is appropriate to be doing in an ER, to serve as an emergency room for healthcare emergencies. But in terms of mental health, the new facility, the behavioral health building itself, it will be able to take and treat patients on a whole new level at IRMC. What are some of those benefits that we'll see?
We will be able to get patients immediate care once they come to the emergency department. The key here is not to have them wait 2 to 3 days, sometimes weeks, to be transferred to another facility. When they have to wait more than 2 to 3 days, I actually have to treat them in the emergency department, which is not optimal. In addition, patients are often sent an hour to an hour and a half away to the nearest facilities. As a result, their families many times can't take the time off from work to make the trip to wherever they are staying. And obviously, family is critical to how patients are treated. We'll be able to mitigate that by admitting them to a local facility. So time to treatment will be dramatically reduced. The distances for the families will be dramatically reduced. This will be a state-of-the-art facility which will have all the latest and greatest opportunities to treat patients with the latest forms of care. For example, the department is going to expand tremendously. I predict tripling in size. We will be adding more psychiatrists, nurse practitioners, and many staff. The department as a whole will also expand to include our outpatient services. We will begin a psychiatric residency program following our family practice residency program. IUP is working on developing a medical school, and we already teach and train students from 5 medical schools along with residents. It's going to be a tremendous increase.
We're talking this morning with Dr. Joseph Buzogany. The Indiana Regional Medical Center has a brand new behavioral health building that is under construction now, and it will increase behavioral health, mental health services for our region in a way that I think is just going to be a tremendous asset for our community and for IRMC as well. Today is World Mental Health Day. Dr. Buzogany, we see the situation that is happening in the Middle East right now. We see local situations such as what happened here in Indiana County over the weekend. But in our daily lives, there are mental health problems and concerns. You mentioned IUP, students who are on their own for the very first time. They have their own mental health struggles. People in the workplace. It probably would surprise a number of people how many mental health concerns there are out there and how much better off we would be if we would recognize our mental health difficulties and seek treatment for them. What are some of the things that people who have struggles with their mental health, what are some of the things that they should be doing?
Be aware of mental illness, first place, accept the fact that it's around and that it's treatable. What I tell my patients, medications are not going to solve the problem. Therapy is not going to solve the problem completely. I tell them to follow the 3 pillars of health: good sleep, regular exercise, and good nutrition. There's a list of things for sleep hygiene that you can do that can tremendously improve upon your ability to sleep, which will then allow you to exercise better. And let's face it, you are what you eat. The other thing that I recommend for people to do is maintain positive relations. Don't isolate. That can be extremely dangerous, especially in someone with bipolar disorder or depression. And get a hobby. Do something. Find something that you really like to do that can take your mind away from the stressors of life.
Even on a daily basis, we might be perfectly fine in every other aspect of our lives, but because we're having what would be maybe the, quote, bad day or the day on which we get up on the wrong side of the bed, all of those things that we attach handy euphemisms to, those are things that in the end can affect our mental health for the entire day and our decision-making process for our lives. And there are things that we can do on a daily basis, too, when we find ourselves challenged in that way, aren't there?
Absolutely. And as I mentioned, I really encourage people to follow those 3 pillars of health, because if you don't follow those, whatever we do to try and treat your mental illness will not be adequate. Over the last decade or so, I have noticed a distinct aspect change in people's lives as to how they view their lives. There seems to be an increase in depression, an increase in stress. I notice that when I walk around the streets and I see people in the grocery stores, I don't seem to see the smiles I used to see in the past. People are extremely stressed out. And you're absolutely correct. The amount of people that are actually on psychotropic medications would really surprise a lot of people. It's a lot more than most people think.
Did the pandemic, and does it continue to have an effect on people's lives? The way that we relate to others, I believe, is much, much different now than it was before the pandemic came.
Oh, absolutely. The pandemic took us by surprise. We did not appear to have handled it very well. Basically, isolating our children in the schools really didn't help matters. Quarantining people, firing people if they didn't get a vaccine, numerous other stressors that have impacted post-COVID ability for employment or to have staff members to provide care. For example, my inpatient geropsych unit is at half capacity because we simply do not have the staff to manage as a full-time or full census unit. The other problem is depression escalated exponentially. The number of suicides escalated considerably. So it has had a tremendous impact. We need to get over it and come around and move forward with our mental illness care, as well as taking care of ourselves. Unfortunately, things like what's happening in the Middle East right now don't help matters because it not only affects the cultures that are involved, but the entire world is seconds away from news of what's happening through the media. I have a problem with the media, and I think they tend to exacerbate the problem with their sort of need to exaggerate the fact, distort the facts. This truly is a problem for average people like me who are not necessarily political hounds, but I have to hear this stuff on the news. My patients come in with panic attacks, and I just simply tell them to stop watching the media. You'd be surprised at how soon they recover.
That's an interesting perspective, and certainly there are mental health challenges in every aspect of society. Military veterans, of course, and suicide. That's a very well-documented stressor that really drags down society. And there are just so many different mental health challenges. It's good to see that IRMC, with their new behavioral health project, is going to address those in a new and innovative way, that the staff is going to be increased and the services will as well. Dr. Buzogany, thanks so much for spending some time with us today on World Mental Health Day.
Thank you. It was a pleasure.
Have a wonderful day today.
And you as well.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com.